Welcome to the Power of Iron Health podcast. We're here to create a community that raises the standard of health and wellness. And today we have a very special topic all about leadership. I have Dr. Fern with me here. He is our clinical director in Peekskill. We're going to talk all about leadership from becoming a PT to how you grow and become a leader in a PT world. So my first question is, what is leadership to you?
Okay, so leadership in my mind is, what is a leader, right? In my mind, a leader is an individual who can go ahead and pull in resources, skill sets, and attributes from a person, a team, a group of people to go ahead and row towards the same direction or row towards a goal in mind. So that to me is a leader. And a leader has vision, tenacity, and resilience in my mind too. So on a constant pursuit of excellence, this individual is always looking forward. They're looking forward, but they're reacting in the moment, if that makes sense. So they're living in the future, but reacting in the present is how I see it. And they're always trying to go ahead and solve issues, solve problems, progress the situation any means, and making sure that the people they have surrounded around them is also elevating at the same time as well.
I love that. Great definition. I would totally agree with that. And that's a very broad definition too. It's not just for PT, but leadership is so important, especially coming from a small business,
Yeah,
right? Like it's so
absolutely.
important to have leaders in the company to make sure that we're excelling at being clinical leaders, to being leaders in the community, for everything, soup to nuts leadership.
Yeah.
Um, but let's start with the base level, right? Like someone who is, and let's talk obviously clinical or
Yeah.
even professional, like a trainer or something like that, right? Like someone's coming into the field. Um, how do they start to excel and become leaders in what they do?
Right,
And let's
right.
start at that base level, right?
From the very base, it starts from self-development, right? People always like to say you can't pour from an empty cup, right? For a leader, right, you need to be so self-developed that that cup is overflowing. That cup is overflowing, and it's that overflow that is pouring into other people. So you can't develop other people as a leader if you haven't developed yourself. So looking into yourself in terms of self-reflection, honesty, transparency, and those are the broad attributes there. But also when it comes to your field in general, like are we studying? Are we looking into the newest cases? Are we taking care of patients? Are we making sure that everything we do is with the idea of growing and being better than the day previous? If I have to say what a leader has to be, it's someone that wants to see better things happen the next day or in the moment, right? They're always chasing more, but they're chasing it in a way that's quantifiable and able to go ahead and progress with time, and they're making themselves accountable for it, right? They're checking the list and they're making sure things are getting done, and not only themselves but also the individuals that are also leading as well. So self-development starts there, but also their vision to do so.
If we start at the base person, like someone comes into our clinic at Iron Health and
Hmm.
they're a base level PT or a trainer, right? Like
Yeah.
what are their core tenements to start to say like, hey, I want to
Right.
develop in my profession? And we can put that leadership cap on
Right.
that because
Yeah.
develop, are you a clinical leader? Are you a
Yeah.
training leader, right?
Right. And so it really depends on the individual, right, and what they come in with. And honestly, the personality, right? So leaders could be developed or they could be innately a leader as well. And so the bare minimum is, can they do their job effectively, right? If they're not good at what they do, then there's no way they could lead others to do the same thing as well. So no one ever got great or ever reached the potential of doing the bare minimum or doing average. So are they going above and beyond? And these are the stepping stones to get to the next level. Are they going above and beyond? Are they looking for more tasks to do? Are they looking for ways to grow, and they asking? Are they asking for the ability to do more? Are they asking for reflection? Are they asking what they could do better? Are they just wanting more in general? And at that point, if they want more, do they have the capacity? Do they want to do it? And if we give them more, are they able to do it in a timely manner as well? And also, like, it goes back and forth between the leadership as well. Like, are we also giving them the opportunity, the environment to thrive as well? So when it comes down to it, is the person wanting to do more than the bare minimum? And if so, do they have the capacity and do they have the wherewithal to do it within that time allotted as well?
Now, if you see someone who has some leadership capability and, going back to that level of developing self,
Hmm.
what are some core components you say like, because I know for me, when I see a new PT, firstly, if I get a new PT who comes to practice or a trainer, I'm like,
Hmm.
hey, you need to like learn your craft the first year,
Absolutely.
2 years to understand how you're gonna really be the best at what you do.
Hmm.
But along that process, yeah, like developing yourself. So what are some core tenements that you help people push to develop
Right,
themselves?
right. So first off, it has to be one, the skills themselves comes with practice, right? But then comes the autonomy Do I have to be on your butt about getting your things done, your notes done? Do I have to tell you when to get your progress notes or how to talk to patients? Or do I have to tell you to follow the time we have allotted for each patient? Are you doing 40 minutes increments? Are you going over it? Are you able to take care of the bare minimum, right? So that's what it is right there, the bare minimum. And after that, we go ahead and see where we can progress from there. Let's just say this individual wants to go ahead and get into a leadership position. How will we end up doing that? So we end up giving them more, right? So if I have tasks that I could delegate to them, I go ahead and try it out, see how they do, and obviously with a handout for help as well. But do they swim or do they drown or do they tread water? And right, and depending on how they react is how I go ahead and give them that help, right? If they're treading water, what can I do to just lighten the load a little bit just to get them above head and now swimming, right? If they're drowning, how can I get them treading, right? And if they're swimming, how can I get them faster? You know, how can I move them faster, right? So it's all about, we always talk about pulling like levers, right? So all about the levers of what we need done. And when it comes to developing another person or leadership, there's so many attributes that goes along with it. It's emotional awareness, social awareness, self-awareness, right? Awareness of people, awareness of the business, awareness of the vision, right? So, but they're so layered because if us as a leader isn't conveying that to the person beneath us or the person we want to bring up, then, you know, it gets muddled in the water as well.
Yeah, totally true. And I would say for those base level people as well, like exactly to your point, like, hey, first job is to make sure you're doing the basics.
Right.
Once you're doing the basics, the next level is like kind of the small breadcrumbs of like, this is how you develop as a person. How's your mind shaping? Do you want more?
Right.
Do you come to me and ask more? Do you ask the right questions? Do you understand what it takes to be at the next level? Because leadership's not easy. I will say that from the top. It's very challenging to be a strong leader and a good leader, and for yourself to grow as a leader, because you have to grow and you have to read and implement things and understand who you are and how you operate. When I think about like those base level tasks, I think you hit the nail on the head. Like, can you do the bare minimum correctly and do it repetitively and consistently, right?
Yeah.
It's like once you're doing that, it's like, okay, like now how do you develop as a person first?
Right.
I used to say a lot with Iron Health, particularly like, and honestly, this is a Jim Rohn quote. If you guys don't know who that is, he would say like, when you're going to a place to work, don't ask like what I'm getting here. Ask who I'm becoming.
Yes.
So are you in a place that's going to foster who you're becoming? Are they committing to helping you evolve as a person? Because we all have to develop as people.
Absolutely.
So we can then, especially in our profession, where we need to transfer that belief to someone else.
Absolutely.
Like we have to be so self-belief that we can do what we need to do to help them.
And that leads into like, are we passionate, right, about what we do? I always say that value follows passion, right? And if you're not passionate in what you do, then it shows. It shows in how you work. It shows how you talk to people. It shows how you present yourself. And if we're not passionate about what we do and how we can get there, there's no way you're going to end up growing in general. Right? You could pull for a while. You could pull your hair out and you can grind yourself there. But at the end of the day, it's not going to be sustainable. So being passionate about what you do and how you do it is just as important as everything else. So it starts with passion, right? It starts with passion, and then it leads into work ethic, right? Because passion is waning and go up and down. There's be good days, there'll be bad days, but a work ethic that's consistent, you can't beat that. And that compounds success / leadership that way. So if an individual is passionate, has a good work ethic, and is consistently showing up, you know they're on the track to be a leader or becoming one or getting to the next level there as well.
Yeah. Now, if you were a new grad for PT or a new trainer, you know, we hear conversations. The biggest thing a lot of them are concerned with is mentorship, which is synonymous with like, am I going to have the correct leadership, right?
Yeah.
Excuse me. So what are certain things you think going into a field like ours, the wellness field,
Yeah.
what questions should people be asking, or what should they be looking for in a place to be an
Right.
employee?
So when it comes down to it, the bare minimum is, are you meeting with your higher up weekly, bi-weekly, at any kind of cadence, right? Like I've had multiple jobs where I've worked there as a staff physical therapist, and I had no idea what was going on besides the patients I was seeing, right? And it wasn't for the lack of wanting not to know, just because they didn't tell me. So are we meeting in a weekly or bi-weekly cadence, and am I learning about what's going on behind the scenes? Sometimes the veil is so thick that we can't see beyond it, and if we can just uncover the veil just a little bit for our followers or individuals that want to build up, that gives them more of a motivation or an insight of, oh shoot, there's more than more than just treating, more than just training people. There's a whole world that I never realized, and is those things for me at least that makes it exciting. I love treating patients. But what's cool is building a business, or how can I do this to get X, Y, and Z, right? And so if we can go ahead and have a weekly cadence, bi-weekly cadence, and the individual is seeking mentorship that way, that's the bare minimum. Do we have a weekly cadence that way? So yes, having meetings, important, right? That differentiates you from a staff employee to an employee to an person that's growing as an individual, right? So there's that. Are there pathways, opportunities to grow within the business as well? Am I going to be a staff physical therapist forever? What is the ceiling here? Am I just looking forward towards my next boost, or am I going to get more responsibilities as I develop myself, right? So that's the second one. So we want meetings and we want development paths as well, right? And the third overall here is like, do I have a say? Does the individual have a say to make a difference? Do my ideas get heard, right? When someone comes up to me and the employee is asking me a question or wanting to implement something, can I take that as well and give them the freedom that they're being heard and that their ideas may be implemented if it's a good idea, right? So it all ends up being a back and forth conversation with the individual and making sure that there's communication, right? That's the end of it. Is there communication between the higher ups and the employee? And is it transparent enough that we can go ahead and go both sides without feeling just one sided? That me just talking down an individual, but the individual can also talk back to me, right? And it should trust. You know, I always say that silence causes confusion. So if you can over communicate, then you know you're in the right path.
Yeah, and I think that's very well said, and that's goes into an empowerment community, right?
Hmm.
Like, you're touching upon, because I've been in different places and I've talked to many people where the veil is so thick for a reason,
Right.
right? And it's like, are you in a community where they keep that veil thick for a reason, where you
Hmm.
don't have a say, and it's just the boss and the employees, or are you in a true leadership environment where it's, hey, we're going to empower people to try to be better. We might not get it, we might not
Right.
get it right, and we're just going to learn and try to evolve from that
Hmm.
perspective. So, being a new PT or a new trainer or a new administrative, whatever you are, like having those cadences, having your say is so important. And then um, I think a big factor when I think about it too, to all that is not all the ideas that you have are going to come to fruition either.
Yeah.
And like understanding that it's a part of the way things have to get done. It's like
Absolutely.
when you standardize something, it's like as we are hearing you. It's just that not everything's going to
Hmm.
come to fruition the way you want it because we have a bigger vision in
Of
mind. But
course.
your input does matter.
Absolutely.
I know we had a meeting once, and one of our admin was like, we do, to Fern's point, we do a ton of meetings, but one of our admin was like, after the course of the meeting, like, wow, this is really cool. It's like what I do actually matters. Like that's such an empowerment to me. That makes me feel good because that's what I want to create at Art and Health. But like that's such an empowering community because then we're
Absolutely.
all driving up together. So are you aligned with like a company that's gonna really take in what you say and try to grow together versus
Absolutely.
growing in silos or just treating,
Yeah.
just like how we talk about people treat clients as numbers. Some
Hmm.
people treat employees like
Yeah.
numbers too. It's kind of
Sure.
crazy. It's like how do you really empower the people to make sure that they're growing as
Right.
individuals? It's so important.
Absolutely. And it depends on the atmosphere you provide too. At least in my facility here, the atmosphere has to be positive, right? And when it comes to hiring on individuals as well as part of leadership is, we care about skill set. We want someone being able to do their job adequately, right? But it's not nearly as important to me as the mindset and personality of the individual, right? So the grit they have, the resilience that they can bring on, and the ability to learn and grow, right? I would take an individual that has those quality sets than someone who's 10 years experience, just because I know we can get that person to that experience, right? But we can't always get that personality in every other person, right? So getting the quality person through the door and making sure that we all have the same core values is just as important. That's why like I feel like Peak Skill is just growing so well, and our team is building, and the atmosphere is so positive. Patients, clients feel like they're really being listened to, taken care of, and they're all having a great time. We're laughing, we're bantering, we're making sure we're making jokes back and forth, and they're comfortable making jokes to us as well. And so it's the atmosphere that we provide here at Iron Health that also makes the ceiling much higher for us to all grow in terms of leaders and employees.
Great. And if you were to start over, like when you came out of PT school,
Hmm.
what would be some of the big things you would try to ask in interviews to make sure that they were giving you this kind of path?
Yeah, yeah. Well, that's hard because being a new grad, you don't really know what you don't know, right? And so let's take a step back even more. Like I wish PT school prepared me a little better to know what to look out for in terms of, leadership or qualities or things to look, just in general, like what's it look like to be lowballed and how do you have conversations and how do you negotiate so you have leverage, right? Things like that. But like I'm going off topic here. But, being better prepared for these interviews and being better prepared to what to look out for. Because as a young individual, you don't know what you don't know, and you don't know until you get there or experience a negative opportunity there. So for me at least, coming out of school, I would have liked to have more meetings, more consistent meetings, and learn more about the background things. I've always been interested in learning about the business side of things and not just being a physical therapist. And I would have probably advocated for more things as well in terms of like, hey, maybe we could do this X, Y, and Z. But when you're that young, you don't know what you could say and you can't say because you're just happy to have a job.
Yeah.
Right. So I would have asked for more meetings and more development too, because a lot of what I did growing up or developing as a physical therapist, things I did on my own. When I first graduated, I worked in this private mill-like clinic. I was seeing 4 patients an hour, and I had 10, 15 minutes with them, right? And then they were handed off to a tech. That tech would take them through exercises, and I wouldn't be able to really regress them based on my own expertise. So you know what I did? I ended up signing on as a personal trainer. I worked full time as a physical therapist and part time as a personal trainer, just to develop my exercise repertoire and my catalog that way, right? So I wish that I had more say in how we took care of patients too earlier on, and maybe it wouldn't have taken me this long to get to where I am. You know what I mean? So it's hard to say what we would have liked to have back then when you didn't know it. But looking back at it now, it would have definitely been more leadership, more mentorship, and more communication across the board. Because there were instances where I'd ask questions and, supervisor would be like, oh, I don't know, or I'll let you know in a couple weeks. And that couple weeks became years, right? So,
Yeah, I totally agree. I think the mentorship, like if I had to start over, it's like the mentorship, how much am I meeting? Is it a structured meeting? Like if
mhm,
I'm a new grad or even a new trainer, it's like, am I gonna learn stuff that's gonna sharpen my blade?
right.
Because when you come out of PT school, I know when I had my first ACL patient, I was like, oh whoa, okay,
Hmm.
this is real. Now I need to have someone to lean on to understand how I could be
Right.
clinically excellent
Hmm.
before I can go into the other stuff. So when you're kind of talking through things with potential employers, it's like,
Hmm.
how much mentorship am I getting here? Because um, yes, I went through PT school, I went all this thing, but when a
Right.
real live patient who's your responsibility, it's like a different mindset. You need to be
Absolutely.
able to go through that process, and then developing that way and having that cadence. And I always say again, like when you're new, like your first year, you just got to learn. You
Yeah.
got to be a sponge, and then you could start to kind of segue into like, where am I going to take this? What's my
Hmm.
next career path?
Absolutely.
But what Fern was saying before, having that laid out to understand that you can grow is so important.
Hmm.
Like, I know at Iron Health, like we have the potential to grow a lot more offices. We need a lot more leaders. I say it all the time.
Hmm.
And it's challenging to be a leader because there's also responsibility with being a leader,
Right.
right? And that's a lot of people think that a title is something, but it's really leadership that's
Right.
so important. And for us too, like in our leadership program, so everyone's aware, like we have a very formalized kind of leadership structure. We have books that you have to read,
Yep.
like back to his point about self-development, like how do you develop as a person is reading books, putting
Hmm.
those things into practice and making sure that you're not stagnant in the way
Yeah.
you think, right?
Yeah, absolutely. And I have a question too. I mean, I see leadership from my point of view, right? I'm in the weeds day in day out, and so are you to an extent, but also your role is much higher than mine, right? You have a bird's eye view, 30,000 foot view of what the business is and what it's going to be. Like I said beforehand, you are living in the future but reacting in the present, right? And so how would you say leadership from your point of view differs from leadership from my point of view? Obviously, it's a grander scope, but I'd love to learn more about that.
Yeah, that's a good question. I think for me, the way I picture it is, well, one, the way I've led over the last years has drastically changed because I spent so much time on developing and
Hmm.
hiring coaches,
Yeah.
learning new systems,
Right.
bringing things in to see like how I can be better. Because to your point, if my cup's not full, how can I teach people to get their cup full and teach their team to get their cup full?
Absolutely.
So I always have to be consistently evolving the way I think and see things and pushing myself as a person so I
Yeah.
can be a better coach to you guys. I say it all the time when we're in meetings, like this is a mastermind. Like I'm here to be a coach, develop.
Hmm.
Um, and obviously the way I see things, I'm very much living in the future. Like
Hmm.
I know where we can be. Um, and that's very different from where we are right now, right? Like Iron Health was a name by choice. We're not just going to be known as PT. Like
Hmm.
the way the world's going, wellness is going to be the key. People
Yeah.
want to live longer, they want to live healthier, and it's not just going to be PT. Like
Mhm.
PTs are the doctoral degree, but we have trainers. Do you have peptides in there? Do you have nutrition supplies? There's a whole broad spectrum of things we can bring in.
Mhm.
Um, so like I know where we're going to go, and you almost have to reverse engineer it and hit it in steps. That's
Right.
the challenging
100%.
part. So when I think about leadership, it's like, okay, what can I, because I know like everyone on the team is in different phases of their leadership, but
Right.
it's like what is the next step to us to get to perfect so we can then grow the
Mhm.
next level.
Absolutely.
So a lot of the way I think about things is making sure it's slowed down,
Right.
um, but still fast at the
Yeah.
same time, right? Like
Absolutely.
my job, the seat I'm in, is to make sure that I'm there for all the leaders on the team so you can develop leaders, right?
Mhm.
Leaders
Yeah.
develop leaders. That's how companies grow tremendously.
I think it was John C. Maxwell that said that a leader who leads a follower, that's how you grow a business, but a leader who leads leaders multiplies a business, right? And it's to our point about the cup overflowing to everyone else's, and then their cup overflows too, right? It kind of just has that multiplying effect everywhere else. So
For sure.
it's really cool seeing how you're handling that, and how you're doing that. And I'm not gonna lie, it looks like a lot of pressure too, because when I'm handling situations in my office too, it seems like, I'm getting this vision from, 30,000 feet above, and I'm trying to go ahead and condense it to something I can do in real time within arm's reach, right? And so, how can I go ahead and have this vision to grow and make that come to life in actionable steps, but also be able to give the front desk, the staff PT, and the trainer the attention and the details and communication they need to go ahead and execute that as well. And so it ends up being all these different levers you need to push and pull, and fires you need to go ahead and mitigate throughout it. And I'm sure it's for you to a grander extent, but it's interesting seeing how um, it all changes with the grandiose of it all as you keep on increasing in leadership and levels like that.
Yeah, I think it obviously. I'm under pressure all the time. That's how I operate. But it's at a level where maybe in the past, for me particularly, I would step in a lot more.
Right.
Where now, like I have draw a hard line in the sand where it's I need to step into the leaders,
Hmm.
right? That's why you're feeling the pressure too, because I think it's important um, that leaders feel that because you're leaders. The
Yeah.
responsibility is
Oh,
supposed to be there.
absolutely.
So it's like that's how you really, really facilitate growth. Where it's like, hey guys, this is where
Yeah.
we are now. You gotta get your
It's
team in
one of
line.
those things too. It's like, I kind of embrace the friction. Let's call it friction, because like if there's no friction, that means nothing's moving, right? Nothing's changing. And when I feel friction, I might get frustrated. We had a meeting, this past week, and I was really frustrated. I think I gave it a bad review, and I was just like, shoot, man. But like I'm feeling this friction, and like it's giving me more of that feeling of like I just need to push harder. Use that friction to push hard and push forward, right? And utilizing this frustration to go ahead and find different avenues to solve our issues in the clinic, or whatever the case may be. And if there isn't any friction, it means you're not doing anything,
Oh, for
right?
sure.
And if we're not doing anything, we're being stagnant. If we're stagnant, then we're not growing, and then it ends up not being the vision we have in mind, right?
Exactly.
So
I think friction's so important. I think you know one of the books we make our leadership team read is Five Dysfunctions of the Team.
yeah.
And one of the key pillars is fear of conflict. When I go into meetings, I say, "Hey guys, like we're not here to have a boring meeting. I'm not here just to be talking and being like one of those bosses to say do what I say. It's like let's figure this out together, and then you have to execute. But if we don't have that conflict, then like I will make a decision and I'll do it. But like we need to be butting heads so we can find the best solution and test things because I think a big factor, especially in a small business, is like you don't have all the answers. Like no matter what the seat is,
Hmm.
my seat, your seat, like we don't have all the answers. We're figuring it out together every
Yeah.
single day, and it's I this might be a little harsh, but I think about it like I wake up every day and I go to war. I'm
Yeah.
going to war with insurance companies. I'm going to war with the competition down the
Yeah.
road. I'm going to war with everyone because it's a mission that I so believe in that we can get there.
Absolutely.
And like I can live in that world, and I've noticed that like not everyone can, so we
Yeah.
have to walk that with a line. But it's so important to have that mindset of like we need that, to your point, that friction to grow, because if
Hmm.
we don't have friction and healthy friction with each other, like it's just going to be a straight line
Yeah.
stagnant. There
Absolutely.
is going to be no growth like if we're not
Absolutely.
challenging each
Yeah.
other.
What would you say would be some advice to an individual that wants to go ahead and, let's just say, become a greater leader, or become, maybe get in your position at some point, or you surpass your position? What are the actionable steps or quantifiable things, or what are some pieces of advice you give someone that wants to go ahead and elevate, and they want to elevate now, but What would you say?
Yeah. I think this goes kind of, it depends on where you are, but you touched a little bit about it before, is like understanding that one, you have to know what you want and you have to be able to get your job done, right? Like, am I getting my job done? Am I hitting certain things that I need to hit? I think one, this is the side tangent, but I think one important thing to understand as any new grad or any new trainer or anyone in any business, like, you're sold this idea of what it should be. And then when you really get into the real world, like everyone has something called KPIs, right?
Mhm.
Key performance indicators. Every single job has this, and wrap your head around that. Like you have to do certain things to make sure you're excelling and make sure like the numbers do not lie. Again, side tangent, but like when I look at it, like the seat I'm in, I can only look at the numbers. We have such
Mhm.
a big team that I can't go and it's like the numbers tell me a story and then I'm going to
Right.
question it. But anyone who wants to take it to the next level is like, am I surpassing my KPIs? Am I hitting it? Do I want more?
Mhm.
And do I want more responsibility?
Right.
Right? That's the big bulk of it. I think
Mhm.
a lot of people go into leadership because they think that's the right track that they have to go.
Right.
But you need to fully encompass that with extra leadership comes
Mhm.
extra responsibility.
Right.
That one of our values, you have to have solution driven ownership over.
Mhm.
Because if you're not taking that responsibility of being like, I'm going to be this next step leader, you're going to say everything else is someone else's
Right.
fault. So it's the mindset of saying like, yes, I want more responsibility, and I'm going to handle it.
Right.
Right. I think that is key in any position of a leader. Like I'm going to handle it. Yes, there might be hurdles that I need
Right.
assistance with, but I'm going to handle it. Like having that in your mind that like no matter what comes up, you're going to figure it out. And then as you kind of progress through that level, is the development factors next,
Right.
right? Can I take on responsibility? Can I excel at that responsibility?
Mhm.
Now, can I develop people underneath me to take
Right.
on more responsibility so you can elevate to the next level, right?
Absolutely.
Because if you can't develop your people underneath you, then you're going to be stuck in that one rung, that same
Absolutely.
position,
Yeah.
right? So it's like you're always replacing yourself.
It's just there's succession. What you're saying. So in terms of like confidence, we walk a thin line between confidence and arrogance, right? And some form of delusion when we're in these kind of positions where it's like, we know what we can get to, right? It doesn't reflect right now, but you almost have to be in this state of mind where it's like it's going to happen regardless. How would you say that's changed since you first started Iron Health? That kind of sense of confidence, self, whatever you want to call it, whatever name you want to give it, how has that changed as you progress as a leader and as an owner?
Yeah, that's a good point. I think the big key phrase that comes to my mind is like, don't put the cart before the horse,
Hmm.
right? So, and look at Iron Health, right? Like we grew to 4 offices very rapidly.
Hmm.
And I always say that was out of naivety more than anything
Right,
else,
right.
right? Because I spearheaded every office.
Hmm.
That's not sustainable, right? I should have been developing people to then open a new office.
Right.
Now, listen, we are where we are now and we have great people in place, but it's about like for your position, for example, and again, Fernando's our clinical director at Peekskill. It's like, I know we can get to this X. I need to get there. I need to
Hmm.
hit certain numbers before we could take it to the next level.
Right.
And the confidence comes from the proof of the numbers.
Right.
Like in a business, everyone knows like confidence comes from like, hey, we set these goals, we hit it. That makes me feel good.
Hmm.
We're gonna do it, and
Yeah.
then we can go to the next level.
Right.
So letting it cook a little longer. That's like
Hmm.
a phrase I would say. Like I was for me, my leadership style was like, all right, we got to do this next thing. But not everyone can operate at that level. It's
Right.
like, we need to do this. We need to execute it maybe for a freaking year, two
Right.
years, let it cook.
Hmm.
And then we go to the next thing. And then we let that cook and we let them
Right.
spray. We develop, we grow, we grow, we grow. So that really has changed over the last couple of years for me. And I think it's such an important factor for anyone, even
Hmm.
for like, let's say a basic staff PT or basic
Yeah.
trainer who's like, I want more. It's like, okay, you can't put the cart before the horse. You want this, but this shows this.
Right.
So can you develop this, and then we
Hmm.
start to test it,
Right.
and you prove yourself, because it's all about proof. Like proof is in the pudding, and
Yeah.
and that caliber. So I would say that's a big thing that
Yeah.
changed.
Interesting. Yeah, no, it's really cool to see. Like, we all don't have the answers at any point, right? And we're always developing, and it's to our point, self-development at every stage there, right? And self-mastery. And if we're not learning something every single day and applying it, then we're not growing as well. Us ourselves as humans, we're also our own little businesses too, right? We have our own little levers we can push and pull to make ourselves better and be a better person in general. And being a better person overall just builds a business overall because you end up being a better leader that way too. So it's really cool seeing how we're never going to be stagnant. You have to actually try to be stagnant
For sure.
to
And
do that. Time's gonna pass anyway, right?
yeah, exactly. And I think a big factor too is, we talk a lot about the core values. Is like our core values in Iron Health are like, if I have someone who wants to be in the leadership, it's like, do you live by these core values?
Mhm.
Like if I'm going to put someone in a leadership position and then we come back to the scenario where they're not pursuing excellence, it's
Right.
like maybe you're not the right person for that seat, because we need our core value alignment throughout the whole company.
Right.
Because what happens when you have clear core values is you weed out people who can't be there.
Mhm.
Like if you have some solution driven ownership is another one. If we have someone it's like that's your core value, hey, this is what you need to hit, and then
Right.
there's just excuses to get there.
Mhm.
It's like they're not really taking ownership of what they need to
Absolutely.
do. So you align that whole kind of chain to say, all right, this is where we are, so we need to get
Mhm.
going. But leadership is so intense. There's so many different things in leadership,
Yeah.
and
Yeah.
uh, the highest level to me of leadership, we said it again, and you talked about John C. Maxwell's like, can you develop the leaders underneath you? Because even if they're with us for a little bit and they go, it's like, did we make them a better person, a better
Right.
leader for their next role?
Absolutely.
Like that is rewarding at the end of the
Mhm.
day. And like having that mindset of like, hey, I'm gonna commit to this time. I'm gonna pour into this person. I'm gonna coach them. I'm gonna
Mhm.
really help them see things for where they can get to, and then
Yeah.
you see what happens from there.
Absolutely. And one thing, that makes leadership so important, especially in our model, being an out-and-out provider here, right? Like we can't hide our excellence behind volume. We have to be excellent every single session, right? And we have to be sure that we tell everyone that we're working with and leadership's intact, that they know that every interaction you have, every person that walks through the door, that is our marketing, our excellence there. That is what we get more patients. This is how we get the benefit, the fruits of our labors by being so good at what we do. But it starts at leadership, and it starts by pouring it down to other individuals as well. So I always think it's interesting that, when I've worked in previous settings too, it's like there wasn't much leadership, there wasn't much meetings, there wasn't much uncovering the veil because I had 90 patients a week. They didn't give a crap if I, was developing myself. They just cared about the people coming through the door. But like with this model that we have and the quality of care that we give, we have to be on top of everything to grow and develop not only as people but as a business, because people are always going to want more. And if we don't give them what they want, then we'll never be able to thrive as well. So that pursuit of excellence that we're talking about beforehand goes hand in hand with leadership and our model as well.
And if you had anyone who was looking for a position in the company, what are certain things they should be looking at? Like if they align with the way we're talking about leadership.
Yeah, yeah. I mean, it depends on, if they want to go ahead and grow and develop as an individual and at some point become a leader themselves, they have to be okay being more than just average. They have to be sick of being just doing the bare minimum, right? So seeking out every opportunity you have and growing upon it and being patient and understanding that this is all going to be a process too. And it starts with yourself. And it starts with like, developing communication skills between the people in the facility or the place you work in. Are you a positive influence? Are you toxic? Are you negative? Are you fun to be around? Do people's days light up when you're around, right? And as much as it's important to have these hard numbers and KPIs, being a decent person is just as important, especially in our model, because if we're not talking, if we're not communicating, if we're not connecting, we're not building relationships, then why would anyone else want to come back to us, right? Especially if we're spending 40 minutes one-on-one time with an individual, either if it's training as well. We are selling ourselves and representing Iron Health or the brand. If we can't show them who we are as people and that we are all collectively good people, then why would they trust us at all? So making sure that they're a positive influence in the workplace as well, and then wanting more. I think that is the bare minimum of becoming a person greater than you were before.
For sure. I couldn't agree more with you there. It's about the wanting the more process. You know, if you want more and you're in a place that's not giving you that, like you got to seek it out.
Yeah.
It's out there. Like where we exist,
Yeah,
right? And
absolutely.
you want to align yourself with someone who's going to take you to the greater good and not just be stagnant in the basics.
Hmm. Amen.
Awesome. If you guys like that content, give us a like. This was all about leadership. Hope you enjoyed it. And we are signing off.
Peace out.